Hey everyone, it's Dr. Becky, Dementia Disruptor, with tips, tricks, and potentially painful truths about dementia. So today I want to talk about screenings. So your doctor might do one of these in the office if they have concerns, or if you say to them, I'm a little worried, I'm having trouble remembering things, I'm having trouble processing things, and I just want to do a check and see what's going on. Now, you may also see these with your loved one who has dementia, because the doctors will also use these tools as benchmarks of, okay, you scored this in your first visit, and then we do it a year later or 6 months later if we see big changes, because it helps us do just a quick check-in of how things are going and what's going on. It's not the full battery, couple days of psychological testing and MRIs and CAT scans. They might do those again later, but these screening tools are really meant to just get a snapshot. And the people tell me all the time, oh, well, Becky, that was just they had a bad day that day and they took an hour. Okay, possibly. So we can take them, because you can even look them up online yourself. So one that's like the grand idea is, I would say, I'm sure there are others that are older, but the one that at least I've been familiar with the longest is called the mini mental state exam. You've probably seen this or heard it somewhere, even if you're watching TV, and they'll say, oh, spell world backwards, count backwards from 100 by sevens. Lots of different things that they'll pull from the mini mental state exam. Another is called the MOCA. It stands for the Montreal Cognitive Assessment. This is one that I've used the most, along with the mini mental. And a lot of similar kind of questions. They're also looking at processing speed. How fast can you answer a question? It should be relatively easy for most of us. What's our memory? If I give you 3 words, will you remember it when I ask you a couple questions in between? Can you do the clock test? The clock test. Everybody hates the clock test. It's a big marker for us. It lets us know a lot of things when we're administering the test. It makes my patients absolutely insane. I can't tell you how many times they're like, if they make stupid clock again, I'm just going to lose my mind. We'll lose our mind too. But it gives us some good ideas. One that's a little bit newer, not saying it's new, just not to remember, is called the SLUMS. It's the St. Louis University memory screen. I might have that wrong. You're seeing me strain my own memory with that one. And it's a little more comprehensive. It's going to give us a little more information, give us a little more direction. It still has the stupid clock test. Sorry, friends. But just another test. And sometimes we try one and we see something, so we try a different screening, because we don't want to send you through not invasive, but just overwhelming exams, where they're asking a lot of questions and they're getting upset, or we're putting them through brain scans and things like that, when sometimes just a little screening like this is going to give us a little bit of a picture. When I used to teach elder studies, I'd have the students all the time say, well, what if they had a bad day? And what if they couldn't spell world in the first place? Well, we take that into consideration. We take all those things into consideration, but it just helps us get a little snapshot. So if you're curious, you can Google each of those screening tools, check them out, take them yourself. When I walk the dogs, I will be honest, I practice some of those questions because I am not good at math. So I'd be thinking really hard about counting backwards by sevens. But I also know that working in memory care, sometimes we throw a wrench and we ask for a different number, especially if we think they have it memorized. Because it happens too, because they want us to think that everything is fine. Because, it lies. We've talked about this. Anyway, check them out. If you're concerned, ask your doctor to run it. You can look over it yourself. You can run it with your loved one if you want. Have somebody run it with you if you're worried about yourself. They're good tools, so use them wisely. All right? As always, like, follow, share, put comments in if you wish. I love reading the comments and getting ideas from all of you. So just keep on keeping on. You're doing an amazing job. All right. See you soon.